So when we look at the data, we know that we start to see certain patterns with diseases. And we've talked about how we would expect to see a decline in our cases as mitigation strategies are put into place, like wearing a face mask and limiting social gatherings and social distancing. Another pattern that we know is that as cases increase and decrease, about 2 weeks after that, we're going to see an increase and decrease in hospitalizations according to what those cases did. And then subsequently, we're going to see an increase and decrease in deaths associated with those cases, 2 weeks to 3 weeks after the hospitalization rates. And this is really because individuals with COVID-19 especially tend to spend a few weeks in the hospital before they pass away from COVID-19. It's not in every case, but it's very typical. That means, given that the numbers we saw a couple of weeks ago, we are likely, unfortunately, to see the trends of deaths continue to rise over the next 2 to 3 weeks. So we know that a couple of weeks ago that our cases were averaging just over 3,000 a day. Luckily, for the last 7 days, our average is now at 2,200. So this is in the right direction, but it's not low enough. Each of us has the ability to help prevent those hospitalizations and deaths and keep us moving in the right direction. This is why we repeat so often to please wear a mask when you're out in public, social distance whenever possible, and they work. They take time, and it takes a few weeks for us to see these changes in our numbers. So give it time and continue to do all these preventative and mitigation efforts that we ask you from public health.